Assalamualaikum everyone, welcome back to this channel. This is me Ali Wahid and we are going to discuss about the drugs of the angina pectoris. So this is the last lecture about it and this is the last classification, second last classification in which we discussed that some calcium channel blockers are also used for it. So in the previous lecture we have discussed some organic nitrates are used for it, some kind of beta blockers are used, but now we can also use calcium blockers. So there are two types of it, dihydropyridine and non-dihydropyridine and dihydropyridine. So non जिसके साथ आएगा वो ज़्यादातर हार्ट के ऊपर एक्ट करते हैं. इनमें दो ड्रग्स हैं, वेपरामिल जो हार्ट पे एक्ट करती है एंड डिल्टिazam जो ब्लड वेसल्स पे एक्ट करती है, बट इसका थोड़ा सा इफेक्ट हार्ट पे भी होता है. किस तरह है ये हार्ट पे जो वेरापामिल एक्ट करती है वो कैसे एक्ट करती है? तो हार्ट के ऊपर हमारे पास दो तरह के सेल्स होते हैं, कॉन्ट्रैक्टाइल सेल्स एंड नोडल सेल्स. इन सेल्स के ऊपर कैल्शियम सेल्स चैनल्स होते हैं जो कैल्शियम का इन्फ्लेक्स करवाते हैं. कैल्शियम इन्फ्लेक्स होने के बाद कम्प्लेक्स बनाता है विद द ट्रोपोनिन. After the formation of this complex, it will activate the enzyme which is called as MLC kinase, myosin light chain kinase, which will phosphorylate the myosin filament, and after the phosphorylation, it attach with the actin filament and cause the contraction or conduction in the nodal cell. So now when you take that verapamil drug, it will block this calcium channel and block all of these processes. And if we check the action of diltiazam on the blood vessels, so here it is the blood vessel. So in the blood vessel also calcium channels are present which cause the influx of calcium. So now the calcium form the complex with the canmodelin, which is a protein present in the blood vessels. So after this formation they will contract, increase the TPR, which means peripheral resistance. Then the blood flow will decrease out in the blood vessels and there will be less oxygen supplying it. So contraindication is that you should not give these drugs to the patient who have already post myocardial infarction because it can cause the death to them. So dihydropyridine, they have more effect on the artery than as on the heart. So two drugs are given here, amilopine and nifedipine. ठीक है, both of these drugs have effect on the blood vessels. So mainly they mainly they affect on the large arteries like aorta. So in the aorta the calcium channels are present because the calcium influx they contract, increase the pressure on the heart. After load will increase out and force increase. So if you give amilopine or nifedipine to that patient, the force of contraction will decrease out by blocking this channel. But adverse effect of these drugs are they can cause severe hypotension, decrease in the heart rate, reflex tachycardia, mean they have decrease in the they have decrease in the blood pressure, but as a result their heart will sense it, their blood receptor sense that and increase the heart rate to compensate it. So this is called as reflex tachycardia. Heart arrest will happen, cardiogenic shock can happen to that patient and heart failure occurs. Indication, we can give calcium channel blockers to a patient who have asthma with heart attack. Okay, so we can give them COPD patient and diabetes, but you may have to mention that we cannot give beta blockers to the asthmatic patient, COPD patient and diabetes who also have heart attack disease within themselves. So this was all. So now the next drug classification is the calcium channel sodium channel blockers. So now we are going to discuss sodium channel blocker. So the drug which is used for it is ranolazine. So mechanism, it will block both sodium and calcium and decrease the contraction, but it is metabolized by this enzyme which is present in your body. So this was the lecture about all the anti-anginal drugs. We have covered the two classification. In the next lecture we will discuss the anti-hypertensive drugs.